Our issue segment tonight, the Trump administration is stepping up its fight against the opioid epidemic. Health and Human Services Secretary Tom Price called the opioid epidemic an emergency, saying the crack cocaine issue of the 1980s wasn't as far-reaching as the opioid crisis is today. Watch.
The president certainly believes that we will treat it as an emergency, and it is an emergency. When you have the capacity of Yankee Stadium or Dodger Stadium dying every single year in this nation, that's a crisis that has to be given incredible attention, and the president is giving it that attention. The president made certain that we understood that he was absolutely committed to making certain that we turn this scourge in the right direction, turn this tide in the right direction, make certain that we see the number of overdose deaths and the number of individuals addicted to medication decreased. And he has made certain that we understand and appreciate that this is an absolute priority of his administration, as it has been from day one.
With me now, anesthesiologist and CEO of the Washington Pain Center, Dr. John Dombrowski. Doctor, what's your reaction to the Trump administration's effort to fight opioid addiction in this country? We haven't really seen a president talk much about the opioid crisis, and this has been going on for some time. It's crippled communities around the country, and I believe there's about 100 deaths, overdoses a day.
You're exactly right. I mean, gentleman has taken bold leadership. And that's what Donald Trump has done. He sees a crisis in America. We're losing 145 Americans every day due to opiates. If you look at it, we've seen an increase of 400% in terms of deaths of the narcotics. This is unsustainable. And the good news is at least we start talking about the problem. We as anesthesiologists are addressing it right now. We're taking care of our patients in the operating room with different medications, post-operatively in terms of their pain care they're going to get. And then this spills over to chronic pain in terms of we know that opiate-based medications are not the way to go, and perhaps we need to look at other medication management techniques, perhaps even injection therapy.
So let's talk about how we got to this problem. So a lot of people, they want to blame Americans. Some people want to blame the doctors for overprescribing. Some want to blame, the pharmaceutical industry. So who is responsible?
Well, as many things in life, it's multifaceted, and everyone has a little bit of blame. You're exactly right. Back in the 90s, we were kind of pushed as physicians to make pain the fifth vital sign. Now, to anyone out there, what is a vital sign? It's your blood pressure, it's your pulse, it's something that is measured. Pain that you tell me, I can't measure that, it's what you tell me. Then there was a big push by the government in terms of Medicare and Medicaid services that pain must be treated aggressively. And during this time, the pharmaceutical industry, Purdue Pharma, that made OxyContin, said, we have a medication that's not addictive that can help these patients. So then you had this, conversion of two problems. And unfortunately, there's a lot of expectations of patients out there, and understandably so. I don't want to have any pain whatsoever. Well, I mean, if you're doing life-saving or life-enhancing surgical techniques, there's going to be some post-operative pain. We do our very best, but it's kind of the way the practice of medicine is. And certainly as we get older in life, there's still going to be aches and pains. We do our best to manage it, but we just have to have reasonable expectations.
Yeah, I recall many years ago it was very easy for people to get those type of prescriptions from doctors. Today, I would say that it is more difficult, and I've had family members that have had surgery, and they're still in a lot of pain, and the doctor won't give them another prescription. So you're saying that's the right move, is to leave people in pain?
No. We would never say that. But what we're doing right now from the American side of anesthesiology and anesthesiologists across the country is working with surgeons, nurses, hospital staff, and patients to do a comprehensive care for that patient. So that patient is not in pain, to your point, in terms of limited medications, but we can do other techniques, other medications that do not have addictive potential or diversion potential that can really help with patients with chronic pain or even acute pain in the operating room.
Yeah, I mean, that sounds like a great option. The idea that they would be able to produce these in a sense, and why was that not done in the past?
Well, a couple of things. Number one, it had to do scientific and research. We weren't really pushed in this direction because we used opiates aggressively. back 20 years ago. Good news is with research and from university settings, we realize there are other things that we can do better. Just like the way we did hernia repair surgery 20 years ago is markedly different from today. Something with anesthesia and more importantly, postoperative management in the acute setting, but more importantly in the chronic setting. And that's what you're really seeing now. A lot of patients have osteoarthritis in the knees or their back. They see their orthopedic surgeon or their internist, and they get kind of hooked on these medicines. Here's the opportunity to talk to family members saying, you know what, is there someplace else you can go to get care? And this is where you see a specialist who specializes in pain to take care of these patients, maybe outside of opiate-based therapy.
And what do you make of this? A lot of people are upset because they want the president to actually call this opioid crisis a national emergency. Does he need to give this a label, or the fact that he's addressing this, does that go far enough?
I think it kind of goes far enough. I mean, I'm not really a politician, I'm a physician, so I really don't know what the language means. I think we're taking it very seriously. This is a crisis, a national crisis, Dr. Tom Price has just said. If you look at the numbers, 9/11, that we had this tragic event, 3,000 Americans were lost in one day. If you look at the opiate crisis right now, we have a 9/11 that happens in America every 3 weeks. Every 3 weeks, 3,000 patients are dying due to substance abuse, opiate addiction. That is a crisis in my mind. And how we take care of it, I think, is first doing this, having a conversation, educating people. People need the information to know, is there something else that can help me outside of a pill, an opiate? And loved ones know that they're kind of going in the wrong direction. So again, seeing that right specialist, that anesthesiologist who could care for you is really a big plus, I think.
Yeah, and people need to be more informed when it comes to addiction. A lot of people say, oh, well, they can just stop taking it. Well, actually, that's not how it works. Your whole brain changes, everything changes, and your life becomes dependent on it. So I think, yeah, there needs to be more compassion when it comes to addiction, and more discussion and learning about what you're taking. And again, all of the great ideas that you gave us. So thank you so much.